Guys, thanks for coming. I'm genuinely excited and pleased to be sharing this with you. My name's Montgomery, Monty for short, and I've called it Body Talk Emotion in Motion. And I don't want to talk about why I've called it that, but hopefully it becomes self-evident as I go. So just a little bit about me. I'm a personal trainer and strength and conditioning coach, but I also work with clients that deal with pain or that have pain. So I have elderly clients, and I'm quite familiar with working with elderly clients, young clients, those in sport. And I started off my career instructing fitness classes. So I'd be instructing with 20, 30 people in a class. And now I specialize more in one-to-one, in personal training. I didn't go to university, but I managed to chat with a couple of the lecturers over at St Mary's, and they decided to give me a shot, and I managed to get onto an MSc for studying applied sport and exercise biomechanics this year, and I'm really, really enjoying that. I'm really excited about it. It's my first real plunge into academia. In personal training, in strength and conditioning, what is the relevance of pain in my world? So let me just invite you in. I see pain come up generally when clients are doing exercises. They will be going through some sort of circuit, or they'll be doing a one-to-one session with me. And they'll be saying, I can't do this, I've got a bad knee, it hurts when I do this. And in a class setting, what I had to get used to very quickly was making a quick adjustment so that they could continue the class, continue to get the fitness benefits, but without being in pain. Now, one of the things that made me want to get more into personal training was that you actually get to develop a real relationship with your client. I'm seeing these guys for 2, 3 times a week, and sometimes up for as long as 5 years. And so that presents a slightly different opportunity. And I want to share with you some of the stuff that we get into. And so it became more than just a quick adjustment of exercise for me. When I get to work with clients that for 2, 3, 4, 5 years, we get into some roots of things that are perhaps a little bit more uncomfortable for them. And so clients that have these painful movements or joints or a memory or history of injuries or something like that, we actually get into exercises that are quite uncomfortable for them. Now, in a personal training setting, we're not necessarily dealing with acute injuries, but we're looking perhaps at clients that have had previous injuries or previous pains. And what I started to notice was that these niggles, aches, would either get in the way of us enjoying what we are doing, or even get in the way of us getting towards our goal, which is, could be fitness, health, or even come to me and saying that they want to do something about this. So I did a little bit of reading and went to some courses, and I started to get into, well, what are the causes of pain? And you will all perhaps be a bit more familiar with this, given it being Therapy Expo. And I don't actually want to get into this today. It's the topic for another talk. Where I actually do want to go with this is, how do we relate to pain? Now, as a personal trainer, one of the things that is so essential to personal training is that you do develop these relationships with people. It's an industry of relationships. Well, it can be. And I want to explain to you, or share with you, how I do that. So, how do we relate to pain? Well, we have the sensation of pain, which we're all familiar with, but we all relate to that pain in a slightly different way. And so this is, this schematic here, or this diagram, is looking at affect. Now, affect is a term that comes from the psychological world, and it's components of two. There's arousal, and this is looking at excitation. So it's not excitation in terms of I'm feeling excited, the emotion excited, but rather looking at nervous system. So it's a raising of breathing rate, of sweating. It's excitation of the nervous system. And then you have valence, which is how good something feels, or how bad something feels. And these two axes together make affect. And so if you're looking at a house isn't just a house. There's the objective reality of the house, which is perhaps what we talk about when we talk about the sensation of pain, the mechanics, the causes, the biological causes of pain. But we feel a certain way about it. It's not just a house, it's a pretentious house, it's an ugly house, it's a handsome house. There's a certain way that we feel about it. And similarly, we feel that way about pain. And so we relate to pain by the way that we feel about it. You have the sensation, for sure, but it might be a pain that when you lift your arm overhead and instead of you feeling just the sensation, you feel a certain way about it. If that pain is stopping you from doing what you want to do, or if it's such a strong sensation that it's actually so uncomfortable, it might be an unpleasant situation. It might cause that negative valence. Somebody else who has the same pain may relate to it differently. And they may relate to it in that when they lift their arm overhead, they feel that change in sensation. Maybe it is pain. Maybe they think that's a good thing. Maybe it's change. Maybe it's a sensation that they haven't felt before. Maybe the meaning that they ascribe to that is that that's a good thing. And so we relate to pain in different ways. The same pain, same injuries, same pathology, we relate to it in different ways. Now, Brodell's spoken about this, and quite handily he's got the green up the top, which is the good valence, and the red down here, which is the not so good valence. And he talks about three different components of interpretation. I'm going to focus on the second one, which is control. How much control do we feel that we have over our pain? How much control do we feel that we have over our body when we do an exercise or when we do a movement? And so in a personal training setting, this is a dynamic that I get to play with. And so as a trainer, when a client comes to me, they may see me as an expert or as somebody who's going to tell them what to do. And this is the norm in the industry that I come from. And so what does that look like? Well, if my client is wanting to develop some shoulder strength, then I'm telling them, lift the dumbbell overhead. Squeeze your fist a little bit harder, really go for it. It's me directing the engagement, it's me directing the session. But there's another way of doing it. And the other way of doing it is giving them the control. Now this is something that I use quite a lot with my clients that have had pain before. We play with this dynamic of control. Sometimes it's me that's in control. They've had this old history, or they've had this history of injuries or whatever it is. They've gone to see the physios, they've done the treatment, but there's something lingering. And what I'm saying is that the lingering is, yes, perhaps the biological stuff, maybe there's atrophy, a loss of strength, flexibility, but there's also this feeling. There's this memory of feeling that stays. And so when I say to them, do this exercise, maybe they have the faith in me, the trust in me, for me to guide them through that and for them to feel okay about doing that exercise. But sometimes I want to give them the rope. Sometimes I want them to take the steering wheel, and I'll ask them, do you think you could go a little bit further? If your shoulder could speak, what would it say when it does that? When you lift your arm overhead and you feel that sensation, what does it do to you? Do you think you could go a little bit further? Now what's this doing? Well, it's sharing the power dynamic between me and my client. It's no longer me that is the expert guiding and taking the steering wheel along this journey of trying to regain a sense of control over our body. It's giving the client the opportunity to do that as well. And so when we do this, we're playing with control and we're learning to expand it, test it. Can you go a little bit further? And we're learning to share it. Now, where's the parallel with pain? Well, in a similar situation, when you lift your arm overhead and you feel that painful sensation, who wins? Is it the pain that has control over you, or is it you that has control over the pain? What is your sense of agency when you do that? And when you play this game with your clients, you parallel that. But what happens when the pain always wins the game of control? We all know this intuitively. When something hurts, we find another way to get it done. When we lift our arm overhead and we feel that sensation of injury or that sensation of ouch, we find a different way to move. And we do this acutely. We all know this, we see it all the time, and we've experienced this. But when that pain happens again and again and again, and we lose that sense of control over the pain, and the pain starts to win, these chronic avoidance strategies develop. And we stop moving in that way. We find out that 1 + 1 = 2. When I lift my arm overhead, I get pain. And we start to develop this concept around lifting our arm overhead, and we endow it with meaning and emotion. And there's a psychologist, Dr. Lisa Feldman Barrett. She does some really interesting work. And she says that our brain makes physiological changes meaningful as emotion. Now, pain is perhaps an inherently uncomfortable thing. It's something that we all don't like. It's not something that we enjoy, perhaps, particularly if we don't feel the sense of control over it. And when this 1 + 1 equation keeps happening, and we keep getting this pain every time we lift our arm overhead, we start to infuse it with meaning. And when we lift our arm overhead again in the future, it can be stressful. It can be that negative affect that we spoke about earlier. And often what we see is this decrease in ability and this decrease in capacity. I was at my jiu-jitsu class 2 or 3 weeks ago, and there's this guy there. We were just chatting in the changing rooms, and he'd tweaked his back in training. And it wasn't just the ache that he felt in his back. It was the ache that he felt in his bad back. And his bad back started 20 years ago when he was playing rugby and he got tackled pretty hard. And he was not able to move for 3 months. And what happens is every time that sensation of pain comes up again when he moves his back, we layer up memory, memory, and memory of experience, and we develop this tower of memory and of experience. And sometimes we see this decreasing capacity that goes with it. Maybe he can't bend his back very much. Maybe he can't do much heavy lifting. We all respond to these ways that we feel about pain differently. And sometimes we see this. And so this is their story. So this is the conversations that happen when I am personal training, when I'm working with somebody for 2 or 3 years. These conversations come up. And it's not just, I can't do that exercise, it's because I've got this history of pain around it. And I'm scared to do that. And what that means is that we have a choice. We can avoid it, or we can start to get into it a bit. And so we play this game of reverse Jenga, and I don't know if you guys can see at the back, but I've got this Jenga tower here. Now the normal game of Jenga is that you take the blocks away and you try to make the tower fall over so that you win over the other person. But this is a little bit different. It's collaborative. And so this tower already has these blocks missing. And so these blocks that represent exercise are exercises that you don't feel comfortable doing anymore, or the client doesn't feel comfortable doing anymore. And the tower has these blocks missing. This tower represents the capacity and the ability to do exercises. And we have this collection of exercises once we've had this painful experience, or especially if it's repeated itself again over time, we have these exercises that we can't do anymore. Now, in a personal training setting, when we're trying to develop flexibility, strength, speed, coordination, sometimes we come across these blocks. And sometimes it's an uncomfortable experience and it's something that is difficult for the client to do. But by sharing the control, trying to test, expand, and playing this almost tug of war, but this, I do a little bit of the guiding of the exercises, you do a little bit of the guiding of the exercises, and we work together and we have a conversation, we can actually put these blocks back in the tower and restore capacity and ability. And so this doesn't happen without communication, because there are going to be some exercises that my clients, maybe your clients, just can't do. It's too much for them. They can't bear it. And so what we do with this is, if we do this well and we communicate well and we share the control and we have this conversation about just doing a little bit more and exposing them to those exercises again, to those kinematics of the exercise, the kinetics of the exercise, the context of the exercise. The guy goes to play rugby again, perhaps. We develop this flexibility of mind and body. And I think this guy said it best.
Empty your mind. Be formless, shapeless, like water. You put water into a cup, it becomes the cup. You put water into a bottle, it becomes the bottle. You put it in a teapot, it becomes the teapot. Now water can flow, or it can crash. Be water, my friend.
And if we get this right, as personal trainers, we have the unique opportunity to be able to work with our clients 2-3 times a week for 3, 4, 5 years. It's not that they come in to see us, they're in pain, we need to fix them quickly. That's not the role that people come to me as a trainer. But by working with physios and working with other therapists, we can develop this sharing of resources between industries. And I have the ability as a personal trainer, the luxury as a personal trainer, to work with these clients and get into some of these things that are perhaps not quite accessible with just the odd session or two. And so just some points to ponder. How can we change affect? The feeling of how good something feels, how nervous it makes you feel, how excited it makes you feel, how perhaps depressed it makes you feel. When we do these exercises and we address some of these old, long-standing issues, how can we change the way that we feel affect by expanding testing and sharing that control with the client? And lastly, how can we change attitudes towards risk and fear of pain, the risk of going back into those exercises that perhaps you haven't visited for 10 or 15 years? How can we do that? How can we expose them to that mismatch, that expectancy of pain, and actually show them that it's okay to move again whilst preserving trust? And my experience has shown me that it's through communication. Communication is what makes us good trainers, therapists, clinicians, and it's what enables those breakthroughs for the clients. A few of these guys helped me put this together. It was a difficult one for me to put together. It's not necessarily my background. And these guys chatted through some stuff with me, and they really did a great job of helping me. So thanks to them. And their websites are up there if you wanted to check them out. Thanks.